This meeting to order. Roll call.
Okay. Director Skill.
Here.
Director Delara.
Present.
Director Logston. Vice President Rodriguez.
Here.
Excuse me, Director Rogers.
Here.
President Barraza.
Here. Thank you. Item B, approval of the agenda.
Second.
Is that not a roll call, right?
No, we can say all those in favor.
All those in favor say aye.
Aye.
Those, almost seen, no. Nays, okay, we're gonna go ahead and move forward. C, public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Do we have any public comments?
No public comment.
Thank you. Item D, consent agenda.
Approval.
Second. Okay. Roll call?
Director Perez Gill.
Yes.
Director Delara.
Yes.
Director Rogers.
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Thank you. Item E, reports. One, campaign and
Madam
initiative.
President,
Yes.
is it okay if we have to ask Will to go knock on the door and ask our director to come in? That way he doesn't miss on, oh, here he comes. I don't want him to miss Alejandro's report.
So then we're gonna go ahead and move forward with reports.
Yes, so the first one we have is our flu and COVID-19 vaccine campaign. As you can see in your packet, we do have the staff report along with the infographic of our progress to date. These figures are through November 30th of this year. We've hosted 24 vaccination clinic at 22 locations, administered 931 doses of vaccines. Those include 534 of flu, 381 of COVID, 5 RSV, 6 shingles, and 5 for pneumonia. And a total of 724 district residents have been vaccinated through these efforts. And this year we were able to capture uninsured and underinsured information. So 38% of those district residents that participated in these vaccination clinics, a total of 276 are either uninsured or underinsured. That information, we get it directly from our partner, CV Pharmacy, that once she logs on, if they do have insurance information, she runs it to see if their insurance covers either the flu, COVID vaccine. If they don't, she bills us, and we did establish, and the board approved at our last board meeting, an additional $7,500 to cover some of these expenses, because we're seeing more and more community members that were either underinsured or uninsured participated in our vaccination clinic. So we still have a couple of clinics to go this month before we conclude our vaccination clinic. We have one at Desert Mirage High School. That's in our partnership with Find Food Bank. As you might recall, you did award a grant award to Find Food Bank for us to participate with them in a couple of mobile clinics. We're going to have our first one at Desert Mirage High School, which is one of their busiest food distribution sites in the Eastern Coachella Valley. We'll be there tomorrow from 2 p.m. to 5 p.m. We are going to start 2 hours prior to the food distribution starting. So because we know folks start getting there really, really early to line up. So as they're waiting in their car, that's going to give us a good opportunity to raise awareness, reach out to them while they're sitting in their vehicle. They could fill out the forms. And actually, we could even vaccinate them in their car without them even getting out of the car and losing their spot. So we're going to do the same thing with Agilon Baptist Church, which is the Desert Island Gateway community in Northern Palm Springs. That's another partnership with Find Food Bank. Same strategy there. We're going to show up a couple of hours prior to the food distribution starting. That line wraps around almost all the way down to Palm Canyon from the James O. Jesse Community Center. And the last one, we're going to participate in the Palm Springs Unified School District Community Giving Day this Saturday, December 20th from 9 to 12 p.m. So that's where all of the parents kind of come in. Last year they had camels and a lot of toy distribution that was given away and a lot of community resources. So this is our second year being invited back to participate in that event. So overall, we're doing pretty well with our vaccination clinics. We do owe you the vaccine per cost. We just got those invoices from CB Pharmacy, so our next board meeting will get those figures for you.
What we paid total and how many we delivered, and that's roughly, that way we can have a number to present to the public about how we're able to vaccinate at a certain rate. Yes, I really want to compare that to what the cost is in an actual clinic or in a hospital setting, or even going to the ER versus what you're doing. I think what you're gonna find is that you're substantially lower, like 10x lower. And that data should be presented because you're redefining the model that healthcare delivery, what effective healthcare delivery is. And that's what I want you to stand on.
Yeah, and per your recommendation as well, we're looking into the price of other vaccines that you recommended.
Yep.
For the RSV, pneumonia, and
MMR.
Yep, MMR. Yeah, so this is part of just the COVID and flu, but the MMR and those other vaccines fall under our DPMG Health vaccination clinics that we do with them, where we partner with all 3 school districts. But yeah, we'll get you that information.
Thank you. Any other question? So there's been a lot of talk in the news lately about the H3N2 virus, which is kind of like the flu, they said, but kind of a little more like COVID. Has there been any talks from the pharmacy regarding that vaccination?
No.
I don't think they have a vaccine for it, but has there been any like talks of them seeing it or?
No, normally who we rely on for that type of information will be the RUHS Public Health Epidemiology Department. They're part of our Coachella Valley Equity Collaborative, and they report out, things that they're seeing. One of the things that was pointed out to us, I believe there was an outbreak at CVUSD with foot mouth disease.
Oh, yeah.
That one of the promotoras kind of brought that to our attention. That there was a breakout at CVUSD regarding that. So we're looking into that, and the county did take that into they were there and they heard about that information. So we're looking into see how we work with that school district to ensure that they know what to do, the resources that are available for them if they need support.
Yeah, I just was wondering about that because they said it might be like another COVID thing and based on our response to COVID, I just was wanting like us to keep in mind that we might have to do the same thing.
Go.
I mean, we don't want to, but.
And there's been a reported outbreak of avian flu that's been transmitted to humans. So, and that's how it started. Not the birds, but.
Be careful.
Any board members want to get vaccinated?
Good work, Alejandro.
Thank you. The next report would be the Pink Journey Foundation. We hosted our last event with them December 6th in North Shore Elementary. Beautiful, beautiful facility. We spoke with the principal there. She's really happy to partner with us on different efforts. We're in discussions of hosting a house fair at the North Shore Elementary, bringing our community partners to kind of share resources with the community there. She's very active. Principal Gentry is just an amazing person. She showed up that day, welcomed some of the families there. She even posted on her Facebook, and 5 school moms showed up because of that Facebook post that she did. So great partnership down there. We do have some upcoming clinics with the new contract that we signed with with the Pink Journey Foundation. At next month's meeting, Megan and I are working on the infographic with key data from these events that we just concluded with the Pink Journey Foundation. And we're also gonna have a testimonial of a individual, very, very moving. I will bring the tissue paper that day. Very, very moving story of what our efforts are, the impact that our efforts are having out in the community. Amazing story of a woman down in Mecca who participated in our screening event, stage 3, borderline 4, and Sergio did this amazing job with case management, and we'll be talking about that. So just gonna give you a glimpse of the work that we're doing out there and the impact, the human impact that it's having outside of these numbers and infographics, but wanted to kind of bring a testimonial into share what our work is doing out in the community.
Any comments, questions from the board?
And last thing I just wanted to point out is that we were in communication with the California Care Force event, so we will be hosting us as a district will be hosting the Women Wellness wing of the event, where we will be doing on-site mammography and on-site pap smears that day for the women that will be participating in the California Care Force on Friday and Saturday, which is February 27th and 28th.
Will it be the same amount that you'll be seeing? Or will the amount increase? Because don't you now see about 30 to 36
Yeah,
on appointments?
yeah, based on the appointments that day, we will be making appointments, but also accepting walk-ins. So yeah, we're gonna try not to book too many appointments so that we could have the availability for women that show up without an appointment that will also be able to receive.
Okay. That's great.
Yeah, so then I put together just a quick infographic of some of the total screenings that we've done with these events. Mammograms, we did 229, pap smears, we did 142. If you scroll down just a tad bit more, the women who required a follow-up screening because of some abnormal reading that they had on their mammogram was 11%, 12% on the pap smear. Women with no prior screening history, we had 22% that received their first mammogram at one of our events and 19% for the pap smear. So as you can see there on the 21st, well, I forgot to mention, we're hosting an event at Esperanza Park, the new park in the Dream Homes area, where that is represented by Director Perez Gil. So we're very excited to do that. We're also gonna have the Division Mobile Unit that day here. So we're planning a nice event there. But yeah, as you can see, some of these figures are very staggering with some of these. And I know from our medical professionals, these are very, very high percentages as we see them.
Do you need to have insurance to attend one of these events, or you can just show up?
No insurance required.
No insurance required. Anybody, even if you have insurance, you can get screened here.
Yes, sir.
Yeah.
Yeah, and we also have the supportive programs. That's part of the case management work that Sergio does. We've coordinated, food box distribution drop-offs from Fine Food Bank to women that are going through chemo or radiation because they could not drive and get their food. So we've scheduled that. We partner with the Desert Cancer Foundation, who is an awardee of ours, to help them with, offset some of the costs for their copay or any kind of medical treatment that they could not pay out of pocket. We also partner, have submitted applications and received funding from the Penitent Foundation and the Susan G. Komen Foundation to assist some of these women that, need the assistance.
Thank you for the update. Any questions, comments? No, all righty, we're gonna go ahead and move forward. Item F, committee meetings. We have Finance, Legal, Administration, and Real Estate Committee. If there are any questions, I'm sure Director Luxton would be happy to answer.
Happy to take any questions or comments off the meeting minutes if there are any.
Is one the action item?
Yes.
7,500.
MOU. F1, amendment number 1, memorandum of understanding between Coachella Valley Pharmacy
Oh, yes.
and the Desert Health District Foundation not to exceed $7,500 to provide vaccines to uninsured residents of the Coachella Valley. Staff, any
It's just for some cleanup amendments that we did on that with the CD.
No, well, it was information item that was brought. We were just sharing it here because it's already been executed under the.
Oh, it's not an action.
Not an action.
It was under the budget for that particular item. We just wanted to share that it tied in with all Hunter's report on the
Any-
responses we get.
Thank you. Do you have any comments on that, questions? Program committee?
The draft meeting minutes are included in the packet. Does anyone have any questions regarding the information provided? Okay, we'll move on to progress and financial reports, also included in the packet. Any questions regarding the information provided? And finally, grant payment schedules located in the packet. Any questions regarding the information provided?
Thank you. Any board member comments?
Happy holidays.
I just wanna,
I was just wondering, Alejandro, there's been no mention of the Promotoras event that we normally have at the end of the year. Is there no plans for that?
Yes, so we do have, we're gonna send the invite out, so we are planning the Promotora event on January 9th. So we'll send the invite out. It's a potluck. Our CEO has authorized, some funds to purchase some of the raffle items that we typically do there. So we'll send the invite out. I'll share the information with Andrea so she can share it out. It'll be the same location at the Palm Desert Civic Center Park, in the little kiosk area. So we'll send that out, yeah.
Thank you.
Thank you.
There was an addition to the agenda that Chris wanted us to give direction.
This was for our regular.
Annual summit.
Mhm.
Go forward. We don't know what the topic will be, but that for, or to approve going forward with on.
Making the motion?
Since it was on our other agenda?
Yeah.
Do we?
Oh, do we, oh, we
We,
forgot that one.
they skipped it.
Provide direction. It was to
We could
provide
just say
direction
provide
for the
directions
next,
to
next year
investigate
review.
it, yeah, to, Not
After we
investigative, but-
finish this meeting, can we open up the other meeting and just address it? Because we have 23 hour notice to be able to have that meeting. So can we just finish this
Can you
meeting
wait
and then
for-
open there?
January? I'm not sure. You said-
yeah.
Late January, okay.
Well, as we conclude another year, I do want to thank staff for all the great work and my colleagues for being such good colleagues. Happy holidays. Thanks. We're gonna go ahead and adjourn at 5:31.
Good work.
Feliz Navidad y prospero año.
Igualmente.